Dyslipidemia is a genetic and/or metabolic disorder involving high levels of lipids in the blood. Risk factors we must avoid include family history, diabetes, sedentary lifestyle, obesity, etc. There are different types of dyslipidemia which are primarily caused by an abnormal lipoprotein transport, usually a deficiency in lipoprotein lipase and apolipoprotein C231. In Mexico, 46% of the population suffers from it, in which 70% of them are overweight and the rest obese. High levels of cholesterol and triglycerides are characteristic for making a diagnosis. Treatment of these disorders aim at a lifestyle improvement with combined use of medication like statins. If these lipid levels are not controlled, it could lead to a cardiovascular and cerebrovascular complication. Our campaign consisted on a visit to San Pedro de Pinta, in which it allowed us to educate adults and young people about the importance of the prevention of this really common disease. We performed medical checkups that allowed us to detect high-risk patients and convince them to have a lifestyle modification. Of the people we interviewed, about 80% of them didn't have lifestyle risks for dyslipidemias, like smoking or a sedentary life. Nevertheless, they do counted with a family history risk for the development of this type of disease, like high levels of triglycerides and diabetes predisposition inside the family history. Based on our results, we concluded that our sample of participants didn't have many of the risk factors for this pathology. The 30 individuals who agreed to participate all had a high education level and were in an environment where sport and healthy lifestyles are promoted, which may have affected our results, since only 25% of the participants were overweight and 11% obese. These abnormal cases we can assure that at least 90% of them can prevent the development of a type of dyslipidemia by only changing their lifestyles involving a healthy diet, exercising, and avoiding smoking and alcohol consumption habits.